look into another condition which commonly affects the elbow, which is golfer's elbow or medial epicondylitis. What is golfer's elbow? Golfer's elbow is tendinosis and inflammation at the origin of the flexor pronator mass. It is less common than tennis elbow, and it's difficult to treat. Men and female, both men and women are equally affected. What is the etiology and pathology of golfer's elbow? This is common in people who require repeated pronation and flexion movement of the wrist and the elbow. For example, golfers or people who play racket sports, plumbers, etc. are prone for this condition. And what are the pathological changes which happen in golfer's elbow? The repeated pronation and flexion movement at the wrist can cause microtrauma at the flexor pronator origin, and this could incite vascular inflammation, vascular hyperplasia, and also inflammation at the muscle origin. If we look into the clinical features, typical patients will complain of dull aching pain on the medial aspect of the elbow, exacerbated by activities involving flexion and pronation movement. They may report weakness in the grip strength as well. If you look into the clinical examination, if you examine the patient, elbow may look normal to look at, but if you palpate, there may be tenderness on the medial epicondyle area. There may be weakness in the grip strength in comparison to the normal side, and the pain may be provoked by a certain movement in the golfer's elbow, with elbow and extension, with resisted flexion and pronation movement. The pain may be provoked. So, what are the investigations helpful in golfer's elbow? X-rays are usually normal. MRI scan may show inflammation and tendinosis at the origin of flexor pronator mass, but which are not generally performed. So diagnosis is mainly based on the clinical evaluation only, based on the history and clinical examination finding. So how to treat golfer's elbow? Mainstay treatment is conservative measures. So the conservative measures are rest, anti-inflammatory medication, activity modification, physiotherapy to stretch the muscles, and also ultrasound guided injection. In majority of the patients, conservative measures are helpful to control the symptoms. In few selected cases, or in minority of the cases, if the conservative measures have failed to resolve the symptoms, then surgical treatment is indicated. Surgical treatments or operative treatment involves open release and debridement and reattachment of the pronator teres and FCR origin. In majority of the cases, patients do feel better. After the surgery, in the rehabilitation period, you provide rest for the initial brief period and gradually improve the range of movement and avoid resisted flexion type of movement. So, in summary, golfer's elbow is tendinosis and inflammation at the pronator teres and flexor tendon origin. Pathological findings include vascular hyperplasia and inflammation at the origin of the pronator teres and flexor muscle origin. The pain is mainly on the medial aspect, increased by resisted flexion and pronation movement of the forearm and flexion of the wrist. X-rays are generally normal. Conservative treatment is the mainstay treatment. For example, rest, anti-inflammatory medication, activity modification, physiotherapy, ultrasound guided injection, etc. Operative treatment do have a role, open debridement and reattachment of the pronator teres and flexor muscle origin mass. This concludes the golfer's elbow